As of April 8, 2020, Wuhan, the city where the coronavirus first emerged, ended its 10-week long lockdown. As people covered with face masks and gloves slowly attempt to gather back in the streets, along with businesses and stores cautiously reopening, the Chinese government hopes to send one message to the public: that life can go back to normal and that the authorities have contained the virus. But the question that lies is, did China reopen its city too early? And what could happen if that were the case? Global leaders around the world are debating whether they are weeks away from reviving their cities or realistically months. Whatever the case be, the health and economic damage has been catastrophic, and these leaders are under immense pressure to re-stabilize their economies. Over 200,000 deaths are confirmed as of April 25th, and life as we know it has come to a standstill. Millions around the world have lost their jobs, and businesses have been forced to shut down. With over 185 countries with confirmed COVID-19 cases, most of these nations have prioritized health and are also practicing some kind of social distancing measures or lockdowns. However, like China, many countries will eventually face the question of when and how to reopen their cities, and whether it is too soon to do so. Perhaps we can take some cues from the Spanish flu of 1918. Being one of the deadliest pandemics the world has seen, the 1918 flu killed upwards of 50 million people and lasted until December of 1920. This influenza pandemic occurred over 3 waves. The first wave that appeared in early March resembled typical flu epidemics. Those most at risk were the sick and elderly, while younger, healthier people recovered easily. However, the second wave of the 1918 pandemic was much more deadly than the first one. By August, historians believe that the virus had mutated into a much severe and deadly one, resulting in the highest fatality rate of the whole pandemic. This wave of infection attacked mostly people from the ages of 18 to 45 years and claimed more lives than the First World War. A study conducted in 2007 showed that different cities in the United States took different intervention measures that largely dictated their infection rate and death rate. The graph shows that cities like St. Louis and Denver, for example, adopted social distancing measures like school closures and public bans, which helped mitigate the initial epidemic wave. However, as soon as there was a decline in cases, measures were relaxed too soon, and these cities saw an influx of deaths with the second wave of infections. This study concluded that cities that adopted non-pharmaceutical interventions earlier and kept them in place for longer did better both health-wise and economically. As the world currently faces the first wave of COVID-19, it is likely that we see a second wave of the virus hit our cities as governments relax social distancing rules and lockdowns.
The CDC director is now warning a second wave of coronavirus infections this winter likely will be worse than what all of us are going through right now.
As some states announce plans to reopen, Robert Redfield tells the Washington Post a second wave of coronavirus could be worse because it could coincide with the start of the flu season next winter.
Just like in Wuhan, other places are going to start seeing a fall in the number of new coronavirus cases. And as we start relaxing social distancing measures in a haste due to economic pressures, the more likely we are going to be hit by a second wave of infections that could be much more devastating. It is too soon to say whether Wuhan was reopened too soon, as there haven't been a significant increase in the number of cases ever since. But for now, leaders around the world can look back to the 1918 Spanish flu to learn from the mistakes that were made and take decisions that minimize the damage that we could face in the coming months.